The Therapeutic Goods Administration has approved the first vaccine specifically targeting the Omicron variant. The vaccine is made up of half of Moderna's original vaccine and half that targets the BA-1 Omicron subvariant. Joining us live now is Professor Bennett, the Epidemiology Chair at Deakin University. Catherine, always appreciate your time. Thank you. What timeline are we looking at here, do you think, in terms of when this will be available for people to actually get? And for those who are thinking, OK, I'm almost ready to get my next booster, is it worth waiting a bit for this new vaccine?
Yeah, it depends on your age, of course. If we've got people who haven't yet had a winter booster who are at risk of serious illness, then it's always the booster you can have now that will give you the best immediate protection. But what we're seeing with these next generation vaccines is a real boost to the antibody response. And so where you have a booster, you get a fourfold increase in the titer of the antibodies against the virus. In fact, you get double that with this new variant targeted vaccine that they've brought out. We're yet to hear about the trial results. They're trialling it in 800 people, looking at its effectiveness against actual infection in the community rather than looking at the laboratory antibody tests, but very promising based on the lab results. So I think for people who are still exposed, we've still got quite high rates of exposure, even though our numbers are starting to come down. It might still take a month or two. We don't know. Once it's gone through TGA approval, ATAGI might be pretty quick on its heels to say, this could be used as a booster. In that case, I think there'll be quite a few people who might have been holding off, particularly younger adults, who might give this a go. If it reduces risk of reinfection or infection, at least for a short time again, that would be something. But this could actually do a bit more than that. This could reduce infection risk more, not just serious illness risk. And hopefully that might be more sustained if it's targeting the specific variants that are circulating at the moment.
Yeah, that'd be nice, wouldn't it? Catherine, this afternoon, National Cabinet is looking at a few issues COVID-related. One of them that keeps popping up every few weeks is mandatory isolation times. There is a push from some quarters, particularly the New South Wales government, to drop that from 7 to 5 days. Is it time to do that, do you think? What do we actually know now about just how long people are contagious for?
Well, we've had some data released just this last week from a longitudinal study where they happened to capture people who were close contacts and actually developed an infection while they were being closely monitored. That's the best information we have about infectiousness. They also cultured the virus to make sure it wasn't just shedding viral RNA, but that virus was viable and could potentially cause infection. The issue with those data, though, is twofold. One is it's based on Delta. Omicron might actually have a shorter infectious period, and also we're a much more highly vaccinated population than this was studied in back a year ago in the UK. So we might actually have a shorter infectious period now anyway. But also, they talk about the days you're infectious, but a lot of people will be infectious for a day or two before they go into isolation, before they have symptoms, before they know to test, or before the RAT test, which most of us rely on, is able to really detect the infection. So they talk about 75% of people clearing their infection by day 7. That's probably equivalent to day 5 isolation period. So in fact, most people will have cleared the infection in terms of shedding infectious virus. Those that continue to shed virus are actually doing that at a low level. So hopefully, if people are following the advice and putting on masks when they do start to go out after isolation, whether it's 5 or 7 days, that helps protect us from that small risk that comes with the quarter or so of people that might still have low-level infectious virus in their system. So it's important that we do follow up isolation well, but I think going from 7 to 5 days is not going to have a measurable impact on our transmission, and it could take some pressure off workplaces. And the flip side of this too is if we don't drop it, people might get fed up, less likely to isolate at all. That would be a bigger cost than actually dropping it a couple of days for everyone and keeping more people engaged.
Well, speaking of being fed up, air passengers pretty fed up with having to put a mask on every time they go onto a plane. What do we know about plane transmission? Is it still necessary to wear a mask on a plane, do you think? Are they hotbeds of COVID transmission?
Well, planes have actually been very good. They were a bit of a model around ventilation. They have high air turnover, replacing the air 20 times every hour, and of course have filtration, have the HEPA filters which help take particles out and clean the air when they go through this cycling. So that's actually been a model for how you can manage people in close quarters indoors without having high infection risk. That's been the story in the past. Of course, Omicron is very infectious, but it still seems to be that it's people around a case that are most at risk. You're taking your mask off to eat. The mask might be slipping off when people are sleeping on long-haul flights. This isn't about people not being allowed to wear masks. This is just removing the rule that they have to. Hopefully enough people who are concerned about risk will still wear it, so that can still manage it as well. But I think we're reaching a point where with low compliance on other forms of public transport, we're going to keep contracting that focus for rules around masks to those high-risk settings, whether it's hospitals, aged care, those sorts of places. I think airlines have dropped that around the world. So we've got people coming onto planes who've just come off another plane anyway. And so it gets harder to keep those specific rules in place where we do actually know that the air ventilation is one form of protection that works on planes. But I encourage people who are at all concerned to still feel safe flying, but wear a mask yourself.
Catherine, I realise I'm asking you to look in the crystal ball a bit with this question, but I'm keen for your thoughts as to whether or not we are through the worst of it for this year. We keep being told the run to Christmas should be pretty good unless new variants emerge that throw a spanner in the works. Have we seen any sign of new variants? The longer it takes for them to come up, does it mean we're out of the woods?
The more lead time we have, the better. It will give us a period of respite, which we desperately need and our health systems desperately need as well. We watch places like South Africa very closely. They've had earlier experiences of some of these variants and they have good genomic testing, so they're able to actually inform the rest of the world about what's on the horizon. They came out of their BA-5 ahead of everyone else because they went into it sooner. But in fact, their numbers have come down to a level that they haven't seen since after, not even Delta, but before that, Alpha. And that's really encouraging. It's also a long break for them. And that's our hope. We knew about BA-5 in February. We're now coming out of the BA-5 wave, but without nothing else on the horizon, that hopefully means we'll have this period where we're dealing with BA-5 in the community, but we're not seeing another great surge. And the further we get into summer, of course, the better we're protected from the impacts of surges anyway, particularly if we have these next generation vaccines up our sleeve. So I think we do have reason to feel that, firstly, Omicron is helping to keep other variants out. It's boosting our immune system. It's still putting some people in hospital. We do need to think about those winter boosters for people who haven't had them that are vulnerable. We don't want to see deaths continue through into our summer. So we want to see the infection rates come down. But if we don't have another variant on the horizon, then we can feel a bit more optimistic about this spring and summer than turned out to be the case last year.
We'll keep our fingers and toes crossed. Professor Bennett, always appreciate you sharing your expertise with us. Thanks so much.
Thanks, Ash.